Just gonna say out loud, I've got the recording.
Hey folks, looks like folks are starting to come back from their breakout rooms. Good morning.
Aloha, I'm bringing you some beach energy from my background screen.
I have snow energy over here, a foot.
A foot of snow. Who's just said that? Where are you?
That's Brooklyn, New York. We have a foot. It's
We were
beautiful.
wondering about you this morning.
I've got internet right now.
Yeah.
Foot of snow. Oh, man.
Very pretty.
My gosh. Well, all right. Looks like folks are starting to pop back in. Welcome back. The final day of our winter workshop, you all. Before we get started, let's have folks drop into the chat. Tell us a little bit about sort of what rose to the top in your coffee discussions this morning. What were y'all talking about or thinking about? Multidisciplinary meetings. Yes. Someone had a dream about nurse statements. Love it. Weren't we saying yesterday we're dreaming in palliative care language? Lizzie says appreciation for our small group. Awesome. Systems changes. Nice. So nice to be in space with folks from different clinical backgrounds. Some of you are like taking this and running. You're developing palliative care programs already. That is amazing. Meeting a new friend, so important. Love it, you guys. What makes this work sustainable? So a lot about sort of practicing mind, body, wellness, resilience, those kinds of things. Forming a new palliative care team. Awesome. Okay, nice. Lots of good discussion. So what we're going to start the morning off with one more visit with Jeannie and George, Brandon's parents. And the way that this morning is going to go is we wanted you all to have a chance to be in a large group family meeting with Jeannie and George, but we thought that role play would just get a little bit too complicated to have all of you coming in and out of the hot seat. So what we're going to do is we're going to do kind of a large interactive demo of what this might look like when you've got both parents, you've got a palliative care team, and you have some of your interdisciplinary team members, your subspecialty team members. So just like we practiced all weekend, we're going to start with a pre-meeting, and and you'll get to meet the members of of Brandon's team, and then we'll bring the family in later, and you'll kind of get to see how that goes. And you all will have a very active role in this meeting. So, so you are going to be taking notes as you watch this meeting unfold, and I'll time out at different points throughout the meeting, and we'll together we'll crowdsource kind of where is this team getting stuck? How can we help them get out of their stuck place? How can we move this conversation forward? So what you will need for this activity is a cat on your lap, Melanie. So Melanie's ahead already. Nice work. You will need your frameworks out in front of you. So to start off with, you'll need your PrEP framework and your conflict framework. And then later on, you'll want to have your team framework and your REMAP framework out. And then you will need a notebook because you'll be doing as best as you can with all these folks. You'll be doing real-time tracking. You'll be trying to write down what you're hearing folks say. And in particular, if you have to choose one thing to focus, we're going to ask you what you noticed that they did well. So if you see folks do something that you liked, circle it, put a star by it. We'll come back to that. And then we'll talk a little bit about where the team gets stuck, just like we did over the last day in our small group role plays. Any questions or anything from my interprofessional team that I forgot to describe about this activity? And Juan is going to be kind of keeping the chat organized for us as well, as you guys can see. And just because sometimes these chats can get pretty overwhelming, what I think I'm going to do is I'm going to have you all be brainstorming, and then at different times I'll have different animal groups actually put their responses in the chat, just so we don't get 150 responses each time. But I'll have you all take a moment and brainstorm. We'll see how it goes.
And Amy, maybe people already still have the hide non-video participants. That's just helpful so that when we all turn off our videos, you can just see the participants in the family conference.
Yes, thank you. So if anybody needs a reminder of that, that's just the little arrow next to stop video. Choose video settings. You might have to scroll down a little bit and then choose hide non-video participants. Make sure that's selected. Thanks, Caroline. Okay, so with that being said, as long as everybody's got that setting on, I'm going to ask us all to turn our cameras off except for our interprofessional team in this demo. I think is that everybody? Are we good? Okay. So Rainey and Michael, can you guys just change your name so that you identify as who you are in the demo? So Michael is playing the role, a real stretch for him, of the palliative care social worker. And Rainey is playing the role of our palliative care spiritual care provider. We have a new neurologist today, not the ones that you guys met yesterday. We have Dr. Brown here. Again, he's the same neurologist as you met yesterday, he just looks a little different from yesterday. And then we have Alex, our bedside nurse. And then we have Kathy, the palliative care nurse practitioner. All right, folks, I'm going to turn my camera off. They're going to get started. Take good notes, and we'll see you in a minute. Oh, Kathy, you're muted.
I just thought I'd start that way so that everyone else can feel comfortable when they forget to unmute. So you're welcome. So good morning, everybody. Thanks so much for taking the time to pre-meet as we plan to take care of Brandon and his family. It would really be helpful to hear everyone's perspective on the family, then talk about the patient's prognosis, map out treatment options. So who has met the family?
You know, I have, and I know the dad thinks that Brandon is suffering and he already wants to move to comfort care. I'm certainly worried about how well he's going to do, but I think it's just too soon to say what kind of recovery could be possible. I've had patients show surprising improvements at this stage.
You know, well, I know mom really wants to take him home, but there's just no way she realized how much, Carrie's going to need. She's focused on this miraculous recovery, and that we all know is not going to happen. She just doesn't get it.
So on one hand, Dr. Brown, you feel like some progress is possible. And I'm also hearing from you, Alex, that Brandon remains really sick, and his potential for improvement may not be as great as what his mom is hoping for or expecting.
You know, I've been spending a lot of time with mom too, and I agree with you, Alex. She wants more time. She has a super strong faith. However, when she talks about miracles, it seems to be like more of a coping strategy. It brings her a lot of strength, but deep down, I think she's really worried.
Yeah. Thanks, Rainey. That is so helpful. Michael, do you have anything to add?
Yeah, I mean, I think Brandon's dad is really suffering a lot too. I think if Brandon has a chance of recovery, he's really supportive. But right now, I think he's just in this place where he feels like we're prolonging Brandon's suffering, and I think it's just eating him up.
Yeah, and even though it seems like they are on such different pages, it's clear that they deeply care about Brandon. And I wonder if it would help all of them maybe to have a better picture of the prognosis.
Yeah, gosh, thanks so much, Rainey and Michael. It's so important to get everyone's perspective on their relationship with Brandon and parents' expectations. Dr. Brown, I wonder if you could share a little bit about where you think Brandon might be. You have so much experience, and we really look to you for some of this medical information.
I wish I could be more clear. It's a really bad injury that he has, and it doesn't look good now. But it's just so hard at this stage. There's always a lot of uncertainty, and he's young. It's still really early.
Yeah, I really hear that, Dr. Brown, that there's a lot of uncertainty. Would it be okay if I share something I'm worried about?
Okay.
So I'm worried that without more clear information, we won't really be able to help this family make decisions.
I hear you. It's just too soon to predict. I've been in these situations before where I gave a prediction and it ended up being incorrect. And I just don't want to do that to this family.
Okay, let's time out there. Folks, students, you can turn your cameras back on. All right, everybody take a moment, look at your notes and circle a couple things or two that you saw the team do well, that you liked there. And I am gonna ask the Orca group to pop into the chat some things you notice, and I want you to put in, if you can remember it, the skill, and then a colon, and then the words that the person used. Orca group, let's see what you noticed. Nice. So Jennifer noticed that Kathy asked permission to share. Is it okay if I share some information? Judy noticed they focused on the purpose. That's okay, Judy. That's all right. You all can send them as you think of them. Can we hear everyone's perspective, prognosis, map out options? So she actually set an agenda for the pre-meeting, right? So in this pre-meeting, here's the things we want to make sure we cover. Nice. A simple reflection statement. I'm hearing on one hand this, I'm hearing on the other hand this. Awesome. Okay. All right. So what was going on? I'm going to stick with Orca group here. What was going on when I timed out? What was the challenge there? Nice. Couple other things you noticed they did well. What was the challenge when I timed out? Yeah, getting insight, trying to figure out. Dr. Brown was really hesitant to offer any kind of a prognosis, right? Yeah. So thinking about that, which part of prep are we on? Which section of prep are we trying to sort out here? Prognosis. Yeah, we're trying to figure out prognosis, right? We're trying to come to some agreement in the pre-meeting about what Brandon's prognosis is, so that we can go into the meeting to give this dad really useful information. And Dr. Brown was really hesitant. So there's a little bit of conflict, right? Kathy's kind of saying, we got to give him some information. Dr. Brown's kind of saying, I can't give him any information. So looking at your conflict map, what step of the conflict map are we on? Okay, nice. There's a few different ideas here. We probably need to acknowledge some emotion. I love that idea. We need to acknowledge we need to acknowledge Dr. Brown's emotion, right? Dr. Brown is really, he's feeling some uncertainty. He's worried about being wrong. So that's one step. And then I see Wendy put in cultivate curiosity, right? We're trying to figure out how can we actually get more information from Dr. Brown about this prognosis. So now moving on, let's have the, I want you all to take a minute and write down what is a cultivate curiosity question you might ask Dr. Brown to get more useful information about prognosis here. Everybody take a minute and write it down. Okay, and then just to mix it up a little bit, sea lions, can you put your idea in the chat? You can go ahead and hit enter whenever you've got it. All right, Nicole, nailed it. Awesome. So thinking about using that best case, worst case, most likely scenario in times of uncertainty. I love that idea. Let's give that a try. Kathy, you got that line you can borrow from Nicole, given your experience. What's the best case, worst case, most likely? Also want to point out, I think it was Bob's idea, we also need to acknowledge emotion. So starting with a nurse statement to acknowledge Dr. Brown's emotion, and then a given your experience statement. Okay, so let's all turn our cameras back off. We'll have Dr. Brown start up again with, I've been in these situations before, and we'll see how Kathy does with your line.
Except I don't think it's Kathy, but that's okay.
Oh, okay.
So I've been in these situations before where, I give a prediction and it ends up being wrong. And I just don't want to do that to this family.
And I mean, I can appreciate it's a really difficult situation trying to balance that information and give them something meaningful. Dr. Brown, I wonder, given your experience, what would you say maybe it would be helpful for them to hear about maybe the best case scenario for Brandon, maybe also the worst case scenario? Do you think you could be able to give them that kind of range?
Yeah, I mean, well, the worst case is really clear. He just doesn't make any improvements from here, and this lack of interaction is permanent. I guess on the other side of that, the best case would be we see him start making some improvements, maybe purposeful movements, something like that. We'd want to see that fairly soon. That would really change the conversation. If we saw him start to wake up a little bit now, and I could imagine with some rehab over months or a year or so, he might make meaningful recovery and do some of his ADLs with some assistance, that kind of thing. Mm-hmm. I'm not all that hopeful about that, but I have seen it.
I super appreciate that. That's really helpful for me too. I think it might be helpful for them. I hear you saying that you don't think some of that improvement is likely or it's unlikely. I wonder, thinking about Brandon from your experience, what you think the most likely outcome would be.
Well, to be honest, Brandon's brain injury is so severe. I worry that even if he does get to a point of getting home, it's going to be with a trach and a peg, and he would need around-the-clock care. I don't think he's going to be able to walk or even speak more than a few words.
Dr. Brown, thank you. That is so helpful. Really appreciate your expertise, and you're willing to take some risk in talking about best case and likely case. So to clarify the idea of most likely, how long do you think it's reasonable to wait before we start seeing some improvements that would suggest he might get to the best case scenario?
Well, I would expect some purposeful interactions within at least the next few weeks. If he doesn't show us anything in that time, that would really worry me. You know, a trach and a peg would give us a little bit more time to see which direction this is going to go.
Mhm.
And what do we do if the father is just so adamant, about, against all of these things?
All right, let's time out there. Students, you guys can turn your cameras back on. We'll have our IDT turn their cameras off for a moment. All right, so we're moving the conversation forward. Everybody take a moment, look at your notes, circle the things you saw people do well, and label the skill they used on your paper. Was it one of those team skills? Put a label to it. What did they do well? All right. Humpbacks, put a couple in the chat. What did you notice folks do well? Go ahead and send those. Nice. So Carl asked that great, Carl pointed out that friendly clarifying question. What do you think the most likely scenario is? Maritas recognized that acknowledging the emotions is a really difficult situation. That's that third person neutral, remember? This isn't, we ask questions about best case and worst case scenario. Nice. Nice work, you guys. Okay. When I time this out, where are we on the prep map? Which step of prep are we trying to figure out here? Let's have nice. Lauren says we're brainstorming. That's on our conflict framework. Look at prep. Are we on purpose? Are we on roles? Are we on eliciting family information? We're figuring out a headline. Yeah. So we're still on prognosis and options, right? And in particular here, we covered prognosis, right? We figured out as much as we can about kind of best case, worst case, most likely. And now the task of the team is to figure out what options are reasonable to offer to this family, right? That is such a key aspect. How many of you have been in a family meeting where all of a sudden somebody's throwing out options that were not discussed at all in the pre-meeting, or something we didn't even think we were going to offer? All of a sudden we're talking about this option in front of the family, right? So the point of this is to actually try to get your team to agree on what options we can offer. And what's the challenge here?
And Amy, if I could just step in for a moment and add to that, I know not everybody works in an inpatient setting. So just to remind us about those of you who work in the home, who work in long-term care, who work in a clinic, solo practice, all of those other kinds of settings that everybody works in, is think about a situation where one of your colleagues or team members has said something that you guys didn't kind of talk about before, and now you're kind of picking up the pieces of what to do about that.
Thanks, Caroline. So what's the challenge with when we're thinking about options here? How long should we wait? Time is the challenge. So Nicole's kind of thinking about, like, we don't know how long to wait before we even think about what the options are. What else? Everyone has their own perspective on what is best for this patient. I love that, Judy. Yeah. So we've got, we have this worry that the parents are in different places. And we also have members of our interprofessional team that seem to be on different placements, on different places, right? We have kind of Dr. Brown, who's got their idea about options. And then we've got Alex, who's a little worried about some of those options. So, so let's take a moment and think about we're gonna think about 2 skills here, different ideas. Nice, Lizzie. Different ideas of what quality of life or the goals should be for Brandon. Awesome. So let's take a moment and think about. I want you to look at your conflict framework. We've elicited perspectives. We've heard Dr. Brown's perspective. We've just heard Alex's perspective about, God, what do we do if the father's adamant against those things? What step of the conflict framework are we on now? Yeah, find shared interests. Okay, awesome. So everybody take a moment and write down in your notebooks a statement that you could make that would state out loud. Remember, find shared interest is all about being explicit about where our goals overlap. So let's think about a statement we could make that would incorporate what we've heard from Dr. Brown about what he's worried about and what we've heard from Alex about what he's worried about in terms of options here. Think about a statement that would incorporate all of the perspectives in that room. Take 30 seconds and write it down. Okay. Keep writing. I'm wondering if I can get Puffins, if you guys can put your idea in the chat, the statement that you, at least we're starting to articulate. Nice. Okay, a bunch of different ideas, a few different ideas here for shared interests. I love this. I love all of these actually. Brian, I'm going to call out Brian's statement. Kind of actually in the shared interest is also sort of naming the gap here, right? We want to give Brandon a chance at meaningful recovery. That's important. And we also really want to be thoughtful about family members who are worried about his suffering. So it's sort of naming, here's the shared interest that we all want, and it's a spectrum. So we're going to try that one. Let's try that one. Before we do, Puffins, you're still on the spot here. What are other, as we think about options for for Brandon here, sort of options we can offer. And remember, when we think about options in the pre-meeting, sometimes it can be helpful to think about sort of 3 options in line with the values triad, right? So we've got, you know, the longevity option, the comfort option, and the independence option. What is an option that hasn't been discussed yet in this meeting? Which of those 3 values have we not, of those values triad, have we not really discussed? Did that question make sense? Okay, Brandon's values. Okay. Yeah, thanks, Juan. As we think about options, using the values triad as a scaffolding, is there a medical option that we haven't discussed yet? Independence, says Lizzie. Nice, awesome. So that kind of middle value in the value triad of independence, and so if we think about independence, nice, Greta, thinking about using a time trial as a potential option to throw out there in the team meeting. Okay, so we're going to go back in. We're going to start with Alex again. What do we do if the father is adamant against those things? And then our interprofessional team is going to use some version of your line. Brian, we really want to give Brandon a chance at meaningful recovery without prolonging his and his family's suffering. And then they're going to see about how they can incorporate time trial into that. So everybody turn your cameras off, and except for our interprofessional team, and we'll go back in. Remember to take good notes, folks.
Amy, the host stopped my video, and so I can't pull it up.
Same for me.
Jess, are you there? Are you able to turn their videos back on?
Yeah, I'm here. I'm
Rainey?
looking into it.
There we are.
All right, so we'll start again with Alex. What do we do if the father's adamant?
Well, what do we do if the father's just really adamant, you know, against all those things?
A really challenging situation. So I think we all want to give Brandon a chance of meaningful recovery without prolonging his suffering or his family's suffering. So it sounds like one option would be a trach and a peg tube to give things a little bit more time. But thanks, Alex, for reminding us that we're also really worried that Brandon's father will feel strongly about not doing those surgeries. So are there other options for another plan we could suggest?
What about a time trial?
What does that mean?
So a time trial can help reframe kind of their waiting period, right? And we do it as a trial of continued intensive therapies. So we would name what we're looking for as signs of improvement over like a specific period of time. And then we'd reassess if the current plan of care is achieving our goals or not. This might help us align with families when we need more time to determine the prognosis. I mean, this is what they need, is just a little more time. I'm wondering, Kathy, can you help us think about what that might look like for Brandon? What would we need to see?
Yeah, thanks, Rainey, for that suggestion. And I wonder, so for Brandon in his case, I think Dr. Brown, what we could suggest is to wait 2 weeks. And if there's no improvement or he's worse, then we could consider transitioning to withdrawal of life-sustaining treatments. However, if he improves, meaning he begins to move purposefully or follows commands, then maybe consider continuing supportive care and revisit the need for a trach and a peg tube.
Yeah, you know, I'd feel a lot more comfortable with that. The data has shown us that of those patients who do make significant recoveries, the vast majority of them will be showing us some signs of improvement, you know, within that first month.
Okay, great, thank you. So it sounds like we've come up with a plan. So I wonder if we can talk about when the family joins us, how to move forward there. So I wonder if there's someone that would be willing to lead introductions and set the agenda.
I can do that.
Okay, great. Thanks, Michael. And then since we're meeting together for the first time, it's good to ask a little bit about Brandon as a person. And is there someone willing to take that piece?
Yeah, I can do that.
Okay, great. Thanks, Rainey. Great. So then after we do our introductions and Rainey asks family a little bit about Brandon, then we'll hand it over to you, Dr. Brown, for a medical update. And then we'll try to understand Brandon's preferences, what they would be given this information. We'll discuss options with family and then ideally make a recommendation.
Okay, let's time out. Students, you can turn your cameras back on. Isn't it lovely to see these ideal pre-meetings, right? All right, folks, take a look at your notes. Circle 3 or 4 things you saw the group do well, and write down, label from your conflict framework or from your prep framework or other frameworks. What's the skill that you saw that person utilize there? Just take 30 seconds, look over your notes and pick out the skills you saw. Teresa, I see you have a question. I'm going to come back. I think you're asking a question, not pointing out a skill. I'm going to come back to you, Teresa. Okay, so some folks are already putting them in the chat. Some people talked about assigning roles. That was great, awesome. Other folks start popping things you saw well in the chat. Lauren noted showing gratitude. Again, thank you, Alex, for bringing awareness to that. Thanks, Lauren, for bringing those specific words in there. Melanie noted we're really gonna have a specific agenda for this meeting and who's gonna do what. Awesome. And a couple of you noticed making room for others. How did Kathy make room for others in that conversation? Oh, Sheila got it. Kathy, could you help us? So that was Michael making room for Kathy, right? Michael passing, he had this idea, or no, Rainey, sorry. Rainey had this idea of time trial and then passed it over to Kathy to kind of help make the specific ideas. Nice. Yeah. Awesome. All right. Okay, let's see here. Anything else? Anybody catch the reflection statement that Kathy used at the beginning? So nice. A lot of you are pointing out the nurse statement she uses a really challenging situation. Yeah. And then yeah, Gail and Amber, you guys are putting together. Yeah. I think a lot about the align step in these pre-meetings and family meetings. This align step is often often a complex reflection, right? You're hearing all this stuff in the background, and then you're using that complex reflection to name sort of the shared interest of the group, and then also where those gaps are. So that was a great, so Sheila put in, we all want to give Brandon a chance for meeting recovery at the same time. We're all committed to this. At the same time, we're worried about this. So let's come to a agreement about how we're all thinking about this. Yeah, thanks, Caroline. Align, that align skill maps to that find shared interest skill of the conflict framework, which then is often a complex reflection, incorporating language you've heard from the meeting before into a summary statement. Awesome. Okay, in a moment, we're actually gonna start our family meeting. Teresa is, tell us what your question is, and we might have time to answer it now, or we might parking lot it for after the family meeting. You can unmute.
So when
Teresa.
you're assigning roles, as they were just doing, I noticed that Alex, the nurse, didn't get assigned a role. And so I'm just wondering if we're wanting to include the entire interdisciplinary team, is it important to make sure everybody has a role?
Oh, great question, Teresa. That's a total oversight. I mean, I think you're so right. We didn't give Alex a specific role, right? And I think when we think about assigning roles in pre-meetings, one thing that, at least as an interprofessional team of teachers, what we have thought about is a lot of people do this different ways. Some people sort of assign sort of a specific role throughout the meeting, like, okay, we want you to be paying attention to emotion and responding to emotion. We want you to give the medical information. We try to avoid that sort of like, here's your job for the whole meeting. But really, we want you to kind of think about, okay, here's how we're going to start things off. And here's how, here's the structure, the agenda. So I kind of combine roles with agenda. So here's the agenda of the meeting, and we're going to kind of assign somebody to take this first part of the agenda. Really, I love that idea, Teresa, and I'm curious if other folks want to pop it into the chat. What could we have said at the end to make sure that Alex and really everyone was included? What could we have added at the end of that pre-meeting to make sure that everyone felt like they had a role? Nice. Krista, what else? Awesome. Did I miss anything? Great. Yeah, so we could have invited participation of the group. Kathy could have said, any other roles we need to talk about. Love that. Alex, anything you want to add, anything you want to make sure we get to from your, oh my gosh. So inviting specific participation from Alex, that's a great idea. Perfect. Nice. So I love those ideas. Yeah. I mean, I think one other thought I had, oh, Melanie gives a specific, are you able to give us an update on how Brandon is doing today? I love that, Melanie, this idea of like, Dr. Brown maybe has this, that is going to be the big picture information share. Alex is the person who's been there for the last 12 hours, 3 days in a row. He can really add in the specifics of kind of what we're worried about in this moment as that comes up, if that is relevant in this meeting. Sometimes I also think, for the sake of time, we kind of abbreviate this family meeting, of course. Sometimes I also think about just stating the jobs that belong to everybody before we go into the family meeting. So I wonder if Kathy also could have said something like, we're anticipating some complex family dynamics. Let's all really make sure we're on alert for emotions and taking turns responding to that emotion, something like that. Let's all really make sure, as Dr. Brown is giving, as our team is giving medical information, that we're paying attention to make sure that the medical information is landing in a way that the family can understand it. So kind of assigning jobs to everybody also in that way. All right, thank you, Teresa. That was such a good addition. I love our interprofessional student team are also finding things that we missed too. Okay, so So we're going to add 2 more players to this family meeting. So I'm going to have you guys continue to take good notes. Everybody turn your cameras off now, and we'll have our interprofessional team come on, and also Jeannie and George. Jeannie, okay, and is George here? Perfect. Okay, and then you guys can go ahead and get started.
So I'm Michael. I want to thank everyone so much for taking the time to be here today. I know people have busy schedules and it's been hard to coordinate this, but I really appreciate that we've all made the time to be here. I know some folks have met and some folks have not, so I was hoping we might just do a quick round of introductions. I'll name people since we're on Zoom and don't have a natural circle, but maybe George and Jeannie, if you could maybe just introduce yourselves first briefly.
Yeah, I'm George. I'm Brandon's father.
And I'm Jeannie, Brandon's mom.
Morning, George and Jeannie. Again, I'm Michael. I'm a palliative care social worker here. And then Dr. Brown, I see you next.
Yeah, I'm Dr. Brown. I'm the neurologist who's been following Brandon since his admission.
And Rainey.
Hi, I'm Rainey. I'm the spiritual care provider with the team. Nice to see you both today.
And Alex.
Yeah, hi, I'm Alex, the RN bedside nurse for Brandon. I've met you both. It's good to see you this morning.
Where's Kathy?
I am Kathy, the palliative care nurse practitioner. It's nice to see you both again this morning. Thanks for making time.
Well, we really wanted to have a chance for us all to be here together so that we could kind of share information, think about what's an update for Brandon, but also be together to make a plan about how we best care for Brandon. Does that sound okay for you today?
Okay. Yeah.
Yes, please.
Yeah.
Thank you.
And we've had a chance to meet and talk a little bit about some of the things that we think are important. But George and Jeannie, I wonder if you could share with us, what are some of your priorities for this meeting? What's most important for you to recover?
Well, my priority is that we do right by Brandon. I mean, I'm worried that we're just letting him suffer.
Well, for me, I just want to fight for Brandon. I want to find out what I need to do to get him home with me.
Yeah, as you can see, there's a lot of tension here. I just want to honor who Brandon is.
I appreciate both of you sharing so openly with us. I have to say it's really clear from talking with both of you how much you both care about Brandon. And I think it's really common for families to have sometimes very different opinions about kind of what to do next in these really difficult situations. So I want you to know that that's why we're here today, and to help you sort that out, to help sort it out together.
Yeah,
Thank you.
It's been rough, been difficult.
Thank you. He's my only son.
In order to make the best plan going forward, it would be really helpful to know Brandon better. Our team is hoping that you can both tell us some things that are important to him, like how does he spend his time?
He's an active guy. I mean, the minute the snow falls, he's up on the mountain with his snowboard. He's a daredevil, and he loves cars. He loves fast cars. He's been teaching me about cars, if you can believe that.
Oh, that's awesome. That really helps give us a better picture of Brandon. And Dr. Brown, I wonder if it'd be helpful to move on to the next part of giving a medical update.
Okay, let's time out there. You can come back on camera. Okay, take a moment, look at your notes, circle what the team did well. Put a label to it. What was the skills they used? Okay, those of you circling and labeling, pick your favorite thing that the team did. Pick one. And I want you to, I love good examples in the chat. Put the words in the chat that they used. Mari noticed a support statement. It's common to have families share different ideas, and we're here to help you sort that out. What a strong support statement, right? We're used to this. We're going to help you through it. Nice. Melanie noticed a nice respect statement. It's clear how much you care for Brandon. Ah. So Bob noticed, this is a great one, Silence by Michael. So Bob actually noticed that Michael offered some opportunity for silence to see if anybody else was going to jump in and use in their statement there, right? So offering, kind of creating space for other folks to participate. And so Sharon noticed, what was life like? Sharon noticed this kind of values mapping, starting to understand who Brandon was as a person. Nice, so much. Great. Introduce, what are your goals for this meeting? Right, so that's amazing. I want to point that one out. Josh, that introduction step is not just about having everybody say their name, but also setting the agenda. So here's the stuff the team wants to talk about. Before we get into that, what's your agenda, parents? What do you want to make sure we cover? That two-part agenda. Nice, awesome. Okay, nice work. You guys are killing it. Okay, so what was going on when I timed out? What was the challenge there when I timed out? Parents, tell us what you noticed. Yeah, Jeannie. So Jeannie was crying and we didn't, and it wasn't acknowledged. And we were about to move into a medical update. Yeah, nice. So I'm going to ask you to think about the house model. Which part of the house are we building right now? I love it. I can see you guys frantically trying to find the house. Nice, we got it. The patient and family story, right? That's the I have to imagine it in my head. I think that's the right side of the house is the patient and family story. Right? And we were about to start moving over to the left side of the patient and family story, but we missed a big part. We only got to hear from one parent about that. So, and just to be honest, again, here, we're condensing this demo, right? To kind of move the conversation forward. If we had more time, there's a lot more questions we'd want to ask about Brandon, hear more about his personhood. That's such a key part of these family meetings. Sometimes you do that before you jump into the family meeting. Sometimes you actually might know a lot about that person before, but if not, this is such a key part of this family meeting. And so just to acknowledge, we're going to condense that a little bit for time. So thinking about, we got to hear something from George. We didn't get to hear from Jeannie. I'm gonna ask the OWL group to put in what is the what are the 2 team skills that you want to use here to move this conversation forward. So if you were sitting in this family meeting and you heard Rainey say, why don't we move on to a medical update? What are the 2 team skills you would use? So we got emotional awareness for sure. Yep, and then I think I'm seeing make room for others. That's that polite interruption, right? Rainey's moving us forward. We gotta politely interrupt, and then we gotta to work through the emotion. Okay, nice. So now we got the 2 skills. Everybody take 30 seconds. Write down what are the words that you would use. So we're gonna do a polite interruption, and then we're gonna acknowledge some kind of emotion here. Oh, love it, you guys. I'm seeing lots of different ways to do that polite interruption, kind of asking permission. You know, would it be okay if I add something here? Can I step in here? And then you all are nursing, got to figure out a way to circle back to Jeannie. I'm going to call out April. Is it okay to tell us a little bit about what's going through your head? I love, April, this piece that you're adding of psychological safety for Jeannie, right? Maybe Jeannie's not in a place. So you're kind of you're asking permission to interrupt, and then you're asking permission of Jeannie, like, is it okay if we ask you about this? So kind of giving Jeannie a little bit of safety to say, you know, I don't want to talk more, but hopefully she will, right? So let's let's go back in. Let's have where am I? Let's have Rainey, I want you to replay that where you're getting ready to move on to the medical update. And then let's hope that one of your team members can borrow that language to do a polite interruption and then safely allow Jeannie to speak if she wants to. Have everybody turn their cameras off, except for our interprofessional team. Okay.
Thank you. You know, that gives us a much better picture of Brandon. And, you know, Dr. Brown, I wonder if it'd be helpful now to move on to the medical update.
And actually, just quickly, Rainey, I'm sorry if it's okay if I interrupt for a moment. Jeannie, I just wanted to see if we could maybe check in with you. We didn't get a chance to hear from you, and I know it can be really difficult to talk about, but I wonder if there's anything that you'd be willing to share, something that's on your mind too.
Thanks,
Michael.
You know, I'm sorry. It's really hard. We only reconnected just a few years ago. And it's my fault, you know? I wasn't around, and I'm just trying to make up for lost time.
Yeah. It's so clear to all of us that you care about Brandon.
I can't lose him. We just got each other back.
Look, Jeannie, we both made a lot of mistakes, right? And we're both working to make amends. I see how hard you're working.
Thank you.
It's so clear that you're both trying to do your best on behalf of Brandon. So thank you for sharing all of that with us. It really helps us understand where you're coming from. One of the ways we can help you make decisions for Brandon is to give you a better roadmap about what to expect when things are this uncertain. Do you think this is a good time for a medical update?
Yeah.
Please.
We'd appreciate it.
Great. So to know where to start, it's important to know what you've already been told. So I'm wondering if you could share that with us, with the team.
Well, it's bad. I mean, his brain is injured pretty bad, and he was without oxygen for a while. That's made matters worse. And now he's hooked up to these machines, and I guess that's the only thing keeping him alive.
Well, Dr. Brown said he could come home. I mean, I know he won't be the same and that he'll need some help, but he could eventually come home. I mean, I'm already seeing him get better.
Jeannie, I'm sorry to interrupt, but what improvements are you seeing from Brandon?
He moves his hands. I mean, I just saw it. He does it when I'm talking to him.
Movements are just a reflex. I'm not really sure this is an improvement.
All right, let's time out there. Students, you can turn your cameras back on. Okay, got another challenge we'll come back to in a minute. First, take a look over your I know, I wonder if we maybe should have given Alex a more specific role in the pre-meeting, right? Before we get to that, let's talk about what they did well. Everybody take a minute, look over your notes and circle the things you saw them do, the team do well. Label the skill you saw. Awesome. I'm noticing Josh in particular really noticed that actually the team being quiet for a while after Jeannie shared her emotion actually allowed George to nurse Jeannie, right? The magic happened. Nice. Awesome. Ooh, Alicia picked out that asking permission, right? After we kind of worked through that emotion, we're trying to figure out, okay, I think the emotional tone is down and we might be ready to move on. Let me check. Is now an okay time to provide a medical update, right? And actually getting explicit permission to do that. Awesome. Nice, so many nurse statements. And then Mari picked up the next ask, thinking about those series of asks before we give any medical information. The next one is like assessing understanding. Mari picked up the words before we go ahead. It's helpful to know what you've heard already or what you've been told. And the team did a great job of kind of letting both parents share their perspective. Awesome. You guys nailed it. Okay. Okay, so when we timed out, where what was the challenge that was going on there? What are we worried about here? As we're thinking about an interprofessional team, establishing rapport and connection and trust with a family, what's the challenge here? Yeah, so a lot of you guys are noticing, right, that Alex's conflict is Kat puts it, worried as Alex is going to shut Jeannie down, right? And so in particular, as we think about our relationship as a team with this family in this global perspective, we're really worried about losing alignment with this team, with this family, right? So by sort of dismissing what some family member is noticing, that can really cause our alignment that we're working so hard to form to get fractured. That can, you know, just a quick, that dismissal can cause that alignment to get fractured. So thinking about if you were in that family meeting right now, you were one of the team members there, what is the, and you're going to do a polite interruption. You're going to have 2 tasks after your polite interruption, right? So we thought about the challenge as one challenge is aligning with the family. So think about what skill you might want to use to try to bring alignment back. So everybody, I want you to take 30 seconds and write down what you might say to realign with the family. After Alex says, gosh, that movement is just a reflex, it's not improvement. Awesome. So a lot of these statements are combining a couple of skills here. So you're doing the polite interruption. Would it be okay if I add something? And then I saw a couple of you really trying to make a respect statement to Jeannie, right? To try to rebuild that alignment. And I see Sharon's got a great idea here, actually just acknowledging that families often see things we don't. Right. So just acknowledge. So we're right now, we're gonna get to Alex in a minute. Right now, we're just thinking about how do we rebuild that alignment with Jeannie. So I love this idea. So let's steal that one from Sharon. You know, like acknowledging that oftentimes families see things we don't, and thanking Jeannie for her contribution. So you got that, my interprofessional team, thanking Jeannie for telling us that and acknowledging she might see something we don't. Okay, now a lot of your statements are so brilliant because you all are also trying to respect Alex and make sure that we are sticking true to our psychological safety and our team skills of making sure we've got a place for Alex too. Okay, so I saw a couple of you come up with the idea of thanking Alex as well. I am curious, and I saw a couple of you do this. I think, what would be the problem if we asked Alex right now to talk more about reflexes versus purposeful movements? What would be the problem there? Yeah, mom might shut down more, right? That could really hurt alignment. Where do you think we are in squashes mom hope, puts mom on the defensive? You guys got it. Yes, 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 yes. Losing trust with mom. And then another even bigger problem. Where are we on remap right now? What are we trying to understand from this family? What are we trying to hear from this family? Where are we on remap? Yeah, we're trying to do a reframe so that we can map values, right? And so if we get way into the weeds of talking about reflex versus purposeful movement, we're not going to get to give that medical information that is going to be so critical for us to be able to hear about values. So that is why I think it's super important to think about how can we ask for Alex's input, but not put it here, right? This might come out as a read my mind question, but you guys are killing this. So I'm going to try this one out. Does anybody have an idea for where we might point to later in the meeting to bring Alex back in? Ooh, Carl, I love that. Yes, so we're going to give a medical update. We're going to elicit values. We're thinking that time trial might be one of the options. And so I wonder if in that time trial discussion later on, we might be able to talk a little bit more about what improvements would look like and what a brilliant sort of pin to put in our brains about a place that we could bring that specific piece that Alex has here back. Nice work, you guys. Okay, so we're gonna, just to summarize where we're at, we're gonna go back in where Alex jumps in and says those movements are a reflex. I'm not sure if that's improvement. Our skilled team is gonna take all your brilliant points here. They're gonna do a polite interruption. They're gonna use Sharon, and I think Sharon said the Herons group idea of recognizing that Jeannie has something to contribute here, respecting her contributions and recognizing families notice things we don't. And then we're going to see if this team can actually also respect Alex and give Alex a plan for a place where we're going to bring Alex's contributions in a little bit later to try to get the meeting back towards the reframe and the mapping values. Okay, everybody turn your cameras off. Okay, Alex, kick us off.
You know, Jeannie, I appreciate that, but these movements are really just a reflex. I really don't see them as a sign of improvement right now.
Alex, is it okay if I step in for a minute?
I'm sure.
Jeannie, thank you so much for sharing that. We do know that sometimes families see things that that the rest of us don't. So we really appreciate your input. That's really helpful. Thank you. And I'm wondering, Alex, if after we have Dr. Brown give us a medical update, if maybe you could help us discuss specific additional signs that we can look for so that you know, Jeannie and George, who's over there, we can all be focusing sort of on the same things with Brandon so that we can both honor Jeannie's statement about seeing improvements and also have really specific things to follow up on.
Yeah, sounds good.
Okay, great. Thanks so much, Alex. Dr. Brown, I wonder now if you could give us an overview of sort of where things are with Brandon.
Sure. Yeah, thanks, Kathy. So Jeannie and George, I know you both have heard what a severe injury Brandon has. I actually first met him 3 weeks ago when he was in the emergency room and things were pretty dire. You know, he had to actually get a craniotomy right then. With they implanted that intracranial bolt so they could monitor the pressure and evacuate the hemorrhage that was going on. We couldn't even tell what was going on with the underlying brain for about a week later. that point, the MRIs showed that the hemorrhage was controlled. Those subdurals had not reaccumulated, but there was just really diffuse axonal injury, multiple areas of ischemic damage that you often see after a hypoxic injury like Brandon had, where he needed CPR. It's been wait and see since then. You know, we've done lots of
Yeah, we know all this, all right? We know all this. What we need to know is what's happening now. What's this gonna mean for him, for his future?
Yeah. You know, it sounds like you're both up to speed on the care he's already received in the last 3 weeks. So maybe it might be more helpful to hear what the future might hold.
Thank you.
Yeah,
Yes.
that would be great.
So, Dr. Brown, we have discussed in our pre-meeting about the best case, the worst case, and the most likely case, and perhaps this family might benefit by you outlining that for them.
Yeah, okay. Thanks, Rennie. You know, I think it's pretty clear from where we are right now that the worst case would be that he doesn't recover any more than where he is now and wouldn't be able to have any meaningful interactions from now on. The best case, that would be where we start to see him make some tangible improvements pretty soon. And if that happened, that would really give me some hope that in the longer term, he could still surprise us.
Thanks, Dr. Brent. I'm really curious too, given your experience and what you know of Brandon, what do you think the most likely situation is for Brandon?
Yeah, well, it's still going to be hard to tell about that. I have to tell you, when he first came in, because he's young and resilient, I was a little more optimistic. I'm still hopeful he could have some progress, but at 3 weeks with very little or maybe no interactions, I'm really worried.
Well, I'm confused. Does that mean he can still come home?
Okay, let's time out there. Students, you can turn your cameras back on. Nice work, you guys. Thank you for those suggestions. I feel like Jeannie was really supported there by Kathy, and Alex kind of has a spot that, so he's still feeling respected. Nice work, gang. Take a moment now and look over your notes for how the rest of that section of the meeting transpired, and circle what you thought, what you noticed the team do well, and label the skill. All right, and as you're coalescing around one, pick one that was the favorite thing you noticed and pop it into the chat. Try to get the exact words if you can. Oh, Judy, nice. I like how the social worker said, I'm curious too. What do you think is most likely? Help preserve that psychological safety of the parents, right? So it's sort of not putting the parents on the spot to ask that, but to really ask it from the social worker's perspective. Nice. That a lot of you guys noticed Rainey's redirection. A summary sounds like you're up to speed. You kind of know what's happened up to here, and then that redirection towards what the future might hold. Nice. And that a bunch of you noticed that polite interruption, lots of polite interruptions. And then Emily named that friendly question, right? So after Rainey redirected from what's already happened to the future, then she used another skill, that friendly question about, I wonder if it might be helpful to hear. Remember that in the pre-meeting, kind of reminding that neurologist, remember how we did this in the pre-meeting? Could you talk about the best case, worst case, most likely? Awesome. And lots of gratitude, lots of thank yous. Yeah, nice. Okay, so when I timed out, we had just asked Dr. Brown what the most likely scenario was. He gave kind of a jumbled answer a little bit. I was more optimistic, but now I'm a little bit more worried. Jeannie says, I'm confused. Does this mean he'll still come home? Do you think when Jeannie asked that question, do you think Jeannie needs her emotion responded to, or does she need more medical information? What do you guys think? Both. The answer is always nice. Okay, so I'm seeing a general consensus. She actually needs a little bit more medical information there. And in a word or two, what makes you feel like it's medical information versus emotion that she having her emotion responded to that she needs? What did you notice about how Jeannie asked that question? I'm confused. Yeah. Yeah. So it was more confusion than strong emotion. And a lot of you put in that body language, which is harder to see on Zoom, but she wasn't obviously emotional, tearful, crying. Nice, awesome. Okay. So so putting that aside, then thinking about where are we in remap here? Which step of remap are we on? Yeah, we're still on the reframe, right? Yeah, Sheila asked, do we still need a clear headline? I think we might, right? So we did the best case, worst case, and then we did most likely, and the most likely piece is still pretty unclear, at least to Jeannie. Nice. All right, so everybody take a moment, and we talked about this in the pre-meeting. See if maybe you have to go back to your notes, but think about what is, if you were going to give a 1 or 2 sentence headline about the most likely scenario for Brandon here, what's your headline? Take a minute and write down your headline here. Okay, awesome. A bunch of good ideas in the chat. Again, really getting to the information and the meaning here. So, you know, in this most likely scenario, we think that Brandon may be able to show some recovery, but we're really worried that he won't get back to being the person he was before. He would still require 24-hour care. A couple of you guys remembered from the pre-meeting, you know, he's going to need around the clock care. we think unlikely to be able to walk or speak more than a few words. Nice. We don't expect him to regain his independence, require significant around the clock care. Okay, awesome. Nice work. So this is a situation where we've done a couple of friendly questions to the neurologist. The neurologist is still kind of having a hard time getting that succinct headline. So we're going to watch one of our team members actually use that clarifying skill here and use that headline that you guys brainstorm for them. So let's go back in. Everybody turn your cameras off and we'll start again with Jeannie. Wait, I'm confused.
Well, I'm confused. Does that mean he can still come home?
So Jeannie, if I could summarize, Dr. Brown, please correct me if I'm wrong, but our whole team is really worried that Brandon's brain injury is so severe that even if he does come home, he will never be independent, and he'll need around-the-clock care and likely will not be able to walk or speak more than a few words.
What? I mean, I can't believe this. I thought you said he could come home.
Jeannie, I wish we had better news.
This is unbelievable. This whole thing, it's just unbelievable. He just needs more time.
I can't even imagine how hard it is to take this in right now, Jeannie. I know this isn't the news that you're hoping for.
It really wasn't. I've been focusing on getting him home, getting him out of here.
So where do we go from here?
Maybe he'll surprise you. You know, he's so strong. Miracles happen, and my faith is really strong.
All right, let's time out there. We made great progress with that headline. We got another challenge. Nice work with the headline, guys. What happened after you delivered that headline? I know. Never feels good to deliver headline. Fine. A bunch of you guys noticed. Go, Alex. Yeah. Yeah, so she heard it, and I love that you put that, Kat. She got it, right? And we know she got it because of that big emotion, right? Like that's a sign to us that she did hear it. Even if her words were pleading and surprising, like we expected that big emotion to happen, and she got it. And a bunch of you noticed exactly that Alex was able to do a really beautiful nurse statement. Anybody get the words that Alex used? I can't imagine. Yeah, I can't imagine how hard it is. Yeah, this isn't what you were hoping for. Nice. So just that understanding statement and that naming statement, this isn't what you were hoping for. Nice work. Okay, so when I timed out, what was going on there? What was the challenge? I timed out. Jeannie says, maybe he'll surprise you. Miracles happen. What was the challenge there? Oh, the dad was starting to get agitated, asking for a miracle. This comes up all the time, right? So how do we kind of navigate this miracle conversation? Yeah, a lot of you guys noticing we definitely need to do more nurse statements, right? We're still in the E of remap, nurse statements. Yeah. So so I think there's kind of two tasks here. When we think particularly about Jeannie's statement, miracles can happen. I'm really hoping for a miracle. You all mentioned wanting to kind of respond to Anybody got a statement that they would use to respond to that nurse statement, or sorry, to respond to that miracle statement? Yes, so nice. So a lot of you are kind of talking about maybe getting into the what ifs, talking about the what ifs. Before we do any of that, right? We've just got to make that nice, strong, aligned statement. We are hoping for that too, right? Remember, as we talked about before, Jeannie heard the information. She got it. She's in that place. We think we're going to check it, but we think she's in that place of asking for a miracle because she knows it's unlikely. So let's align with that miracle. We hope for that too. And then I'm curious, a few of you put this in there. I'm curious if there's a invite participation task we can bring in here. So we make a strong aligned statement. Is there a team member that we might want to bring in here as we think about this miracle language? Lots of different ideas in there. So I love it. Y'all are thinking about trying to be creative about folks to bring in here. So, and I saw a question about, is there a way to align with the miracle without agreeing to it? Yeah, I think let's watch for that. Let's see if we can align with that miracle. And then I think let's dig into this miracle a little bit. Let's bring in our spiritual care provider. Rainey previously addressed this in the pre-meeting. Nice. So let's see if the team can actually bring in the spiritual care provider, and let's see how this team navigates this miracle a little bit. I love your guys' idea. We're going to start with alignment, and then we're going to invite participation. So thanks. You guys can turn your cameras off. We'll start back up with Jeannie again. Maybe he'll surprise you.
Maybe he'll surprise you. You know, he's so strong, and miracles happen, and my faith is really strong.
No, Jeannie, we're hoping he surprises us too. Rainey, I wonder if you have any kind of thoughts that you could share.
Jeannie, over the past few weeks, I've witnessed your strong faith, and I know it's a great source of strength to you. I'm wondering, can you tell us what a miracle might look like for you?
I hear what you're saying. I just didn't want to admit it. But I see him. I'm just trying to hold it together. I'll never give up hope that he'll one day, walk out of here. His life was just starting. We were starting to spend time together.
Jeannie, listen, I really appreciate how you've been here for him. It's just too hard for me. But it's comforting to know that he has someone here who loves him. This situation, this whole thing, it's just awful, but I do know that you love him so much.
I do. I love him too. Thank you.
George and Jeannie.
I love him, and I know you love him too. So where do we go from here? What do we do?
Yeah. I appreciate that question. I wonder, George and Jeannie, given what we know and some of the concerns we've talked about, if Brandon would sit here with us right now and hear what's going on, I wonder what he would say.
Oh, I mean, we never talked about it. He's 22 years old, but he's so independent. His entire life is being about being outside, doing things on his own. And you know, he had this friend, got into an ATV accident. Brandon told me he'd never want to live like that, being so dependent on others, not even able to wipe his own butt. Barely able to communicate. Yeah, he said he'd never want to do that.
I know all that too. He's such a strong-willed man. Just can't believe who he's become. But that's just it. He is so strong. He's overcome so much.
Yeah, I hear you, Jeannie, I do. But all these machines he's hooked up to, it's just too much. I mean, if it was temporary, that'd be different.
I know that he'd hate all this. I know he wouldn't want to live like this forever. But how can we know it's not temporary? What if we make a hasty decision and we're wrong? I couldn't live with myself.
Okay, let's time out there. Come on back, students. Okay, take a peek at your sheet. Circle a couple of things you saw the team do well. Yeah, Teresa, yay to the empty chair. What a powerful empty chair statement. Yeah, a lot of silence to kind of let the family talk to each other a little bit. Nice. A lot of silence. Nice. Melanie noticed that beginning, that aligning. We really hope he surprises us too. That feel authentic to people? Can we say that? We know that's unlikely, right? We can say we hope for it too. Yeah. I love, Gail, that specific language. No, like, remember we talked about a lot in fall quarter, that directional mapping, knowing what we know now. What are you hoping for right now, right? So grounding it in the medical information we have right now. And then Emily pointed out the way Rainey really asked, you know, tell us a little bit more about what that miracle would look like. And we were able to actually, that was a great way to just hear more about what Jeannie's thinking, right? She actually was able to acknowledge that part of this vision of him getting up and walking out of here is a coping mechanism for her. That's how she's getting through the day, right? Nice. What does a miracle look like? Nice. Okay. So when I timed out, which step in remap were we at? Yeah, we were mapping values, and I see Glenn put in there, and Lizzie, we're starting to transition into a line. Okay, so let's think about, if we had more time, maybe we'd do some more mapping values. I'm curious, as you listen to Jeannie and George, are there places where their values really overlap that we can use an align statement or a complex reflection statement to highlight? Take a minute and write down a reflection statement. It's a line reflection statement that highlights the places where their values overlap. Awesome. So a lot of you guys really noted. Yeah, I'm hearing as I listen, I'm hearing that that Brandon really values his independence. They're so central to who he is, right? And in that, I'm going to add that piece. The current state, the current medical state would not be acceptable, right? So I'm hearing what you say is that Brandon really values his independence, and the current medical state would not be acceptable in the long term. Nice. There's a second part to this reflection statement that I'm wondering if we might need to add a second part just to address the fact that Jeannie, kind of where Jeannie's at, right? When we timed out, what did Jeannie say? How can we know it's not temporary? So how are we going to address that part? So we're definitely going to say that part about the current state would not be acceptable long term. How are we going to address in our align statement this idea that we also need to make sure we've given him enough time? What would you add to your reflection statement? We're going to get there, April. Before we get to the recommendation, what would you add to your reflection statement to reflect what you heard from Jeannie? That other piece of this. It also sounds like we want to make sure we've given Brandon enough time. Nice, Emily. If he's going to recover, we want to make sure we give him enough time. Nice. Okay, awesome. So we've got a combination reflection statement. We've worked together to craft. We've got, I'm hearing you say the current state would not be acceptable in the long term, but that also if there's a chance for recovery, we want to give him space to do that as well. So let's go back and use that aligned statement and see where that gets us, okay? Turn your cameras off, take good notes. We'll start back in with Jeannie, what if we make a hasty decision? I couldn't live with myself.
What if we make a hasty decision and we're wrong? I couldn't live with myself.
Thank you, George and Jeannie, for sharing so much about who Brandon is and what he values. Sounds like his independence is a really important part of who Brandon is, and we really hear that. I'm also hearing that if there's a real chance that Brandon could make significant improvements, that it's important that we give him that chance, that we give him some time to show us that. I'm also hearing that you all agree that his current state wouldn't be acceptable in the long term. It's important that we're honest with you if we get to a place where we feel significant improvements are unlikely. Am I getting that right?
Yes. We need to give him a chance. And yes, you're right. I know Brandon wouldn't want us to put him through all this if he really isn't going to get better. But I mean, I just feel like we need to give him more time.
He's already suffered so much. If we know his chances are so low to make big strides, I don't want to, drag it out. I'm okay with a little more time, but how much time are we talking about here?
And thanks so much, Jeannie and George, for sharing about Brandon. Dr. Brown, I'm wondering if you could share with us what might be a reasonable time for us to wait that would give us a sense that Brandon was going to make these improvements.
Yeah, well, I'm worried right along with you, but for the patients who will make those big improvements, we almost always see changes within the first month. So I think another week or two would really make me feel more certain.
Okay, time out, folks. Group, go ahead, turn your cameras back on. Nice. I loved that aligned statement we crafted together. Anybody notice what Kathy added to the very end of our aligned statement? Am I getting that right? Yeah, awesome. Yeah, am I getting that right? Right, so that's her way to check in. I think this is what I heard from the family. Let me just check with you. Nice, okay. And then we kind of got agreement from the family about that. And then this question from George about how much time are we talking? And Kathy did a great job of inviting Dr. Brown's participation there with those really specific question about how much time. And so we got the information from Dr. Brown about how much more time. Okay, so a lot of you guys in the chat before this were ready to move on to the recommendation. We can't forget that key alignment statement. We got to show our work before we move on to the recommendation. Okay, so now we're going to move on to the recommendation. What's our recommendation here? What are we going to recommend? I think Brian put it in already. Time trial, yeah, time limited trial, awesome. And who can recall what are the 4 components of a time trial recommendation we want to make sure we cover? So we got 2 weeks, so we got time. What else do we want to cover? What else do we want to talk about in a time trial? What are the 4 components? Okay, what does improvement look like? What does better look like? What does worse look like? Time, better, worse. Anybody remember the 4th one? A plan to regroup. I put that under time. What we do, yeah, what we're going to do in that time. A time trial is really, the really beautiful thing about a time trial is it allows us to spend this time aligning with the family, right? So actually, when I think about offering a time trial recommendation, a key piece is aligning with the family's hope. So I think of the 4th aspect of a time trial as hope. We're doing this because we are all hoping that Brandon is going to show some improvement in this time trial. So it's a very key tactic to rebuild our alignment with family. Nice work, you guys. And thinking back to the very beginning of this meeting, here's the spot where we're going to try to invite Alex back into the conversation, right? Here's the spot where you all pointed out when we look for signs of improvement, we're going to invite Alex. I'm going to remind our interprofessional team to look for an opportunity to invite Alex back into the conversation. Okay, so this is the last section of the family meeting. Watch for how the team addresses time, better, worse, hope, and invites Alex's participation as well. You guys can, everybody turn your cameras off. We'll watch how this meeting closes.
So, yeah, well, I'm worried for the patients who do make those big improvements. We're almost always going to see those within the first month. So I think another week or two would make me feel more certain.
Thanks, Dr. Brown. I wonder if it would be all right if I make a recommendation.
Yeah.
Yeah, please.
So while we hope with you, based on what you're saying is important to Brandon and what we know about his medical situation, I think we should continue full medical support for 2 weeks. If he makes improvement in that time, we'll continue to support him and we can discuss the trach and the PEG tube. However, if he stays the same or gets worse, we shift our focus toward comfort and stop life support.
Jeannie, what do you think?
It's so painful to consider. I mean, yeah, and we know he isn't gonna get better. I don't want to be selfish, but for now, I just have to believe that he'll improve.
Dr. Brown and Alex, I wonder if you could share 2 or 3 things that we and the family could look for to see if there's some improvements.
Yes, I really would be looking for some kind of purposeful movement. Alex, how about you?
Yeah, when I do my assessments, I'm looking to see if he's able to track, with his eyes, or if he maybe can, follow some real simple instructions, like give a thumbs up.
Then Dr. Brown and Alex, still, I wonder if what happens, what we're all hoping for doesn't happen. I wonder what it would look like if Brandon was getting worse.
If Brandon doesn't do any of those things or starts to have repeated setbacks like infections or pneumonias or any of the things we see when a person is in an ICU, I think those would be clear signs that he's not going to make those improvements that we're looking for.
So George and Jeannie, we really want to emphasize that we as the team of people caring for Brandon, that we will continue to do everything that is helpful in giving him the best chance at recovery. At the same time, we want to avoid things that are unhelpful or even harmful. In the event that he does get worse, has a cardiac arrest and his heart stops and he dies, I recommend that we allow him to have a natural death and avoid things like CPR because they would not be helpful in getting him toward the goal of having him make a meaningful recovery. So that would be our recommendation.
Yeah, that'd make me feel better. I don't want him to go through that.
This is so hard for me to think about. But from what I'm hearing, if he goes, it will be God's time to take him.
All of us have been so very impressed with how thoughtful you both have been taking care of Brandon's and following, his values and wishes, and being present with him and really being his voice.
Thanks.
Thank you for taking
Thanks.
the time to talk to us.
We're not exactly a traditional family, right?
Jeannie and George, we clearly see what a loving family you are for Brandon. I want to thank you again for taking the time to be here with us and share so openly with us and help us find a pathway forward. It sounds like from what we're discussing, maybe it would be good if we plan to meet in a couple of weeks, in 2 weeks. And if I want to be clear, if for some reason in that time Brandon gets sicker, we of course will be in contact with you. We could, of course, can connect again sooner. And that through this whole time, I want you to know that we're going to be here to support you and answer questions you have them and be available however you might need us.
Thank you so much.
Thanks. I appreciate it.
All right, time out there. Woo. Big ups to our interprofessional team. Nice work, guys. If only we could time out in our real family meetings and get together with 40 of our closest friends on Zoom to decide what to do next. All right, one last time, and then we're about to go into a break. One last time, you guys look at your last notes and just circle, note what are the skills you saw folks use in that last section. Lots of good support statements. We're doing this together. Yeah, Gail noted that here are the things, starting with the things we should do. Here are the things we're going to be continuing that are really important. Here are the things I think we actually shouldn't do because they won't help, right? They're not going to be helpful in this situation. But starting with that stuff we should do. Nice. Nice. You guys noticed, awesome respect and praise by Alex. We were able to incorporate Dr. Brown and Alex's expertise in that time trial. Kudos to Kathy for saying the really hard things about CPR. Yeah, awesome. Awesome. Clarity amounts to the emotional muck. Yeah, nice. Yeah. Dr. Brown respected and brought Alex back in. Yeah, I know. I loved that, hearing Dr. Brown actually bring Alex back in there too. That was great. Yeah, I think I wanted to highlight that conversation about code status again and just really make that point of, how helpful it can be that comes as part of our recommendation. Again, as really framing it based on values, based on what we've heard, what we know about the medical information. Here's the stuff we're going to continue to do. And then here's this piece I actually just want to say I don't think we should do, right? Because it's not going to be helpful. Okay, nice work, you guys. I just want to give a quick moment and a shout out. Jeannie and George didn't get a chance to introduce themselves yesterday. So Jeannie, Deb, do you mind just saying hi and introducing yourself to our group?
Hi, I'm Deb Person. I've been the standardized patient for about 13 years now. And I just want to say that I am so grateful to be able to be involved in this process. I mean, it is just absolutely encouraging. And I want to thank you.
Thanks, Deb. And Harold, do you want to introduce yourself?
Hi, everybody. I'm Harold Phillips. I'm an actor in the Portland area, and I just want to echo everything that Deb said. I want to thank you for doing this work. It's hard work, but your patients and their families are going to benefit greatly from it. So thank you, and thank you for letting me be a part of your training.
Thanks, you guys. Lots of love you're getting in the chat. We are so appreciative of you all. And thank you again to Kathy and Michael and Rainey and Grady and Jim for taking part in that demo for us. It's really fun to see you all in your element. Okay, we are going to take a break now. We're